Prime Minister Keir Starmer said the NHS's two options were to reform or die after a major review found the struggling National Health Service is in serious trouble. The NHS will not get any more money without major reforms to improve the service, Keir Starmer has warned. The PM told the country it will take a 10-year plan to fix the health service after a damning report found the NHS is in serious trouble. The rapid 9-week review, carried out by surgeon and former Health Minister Lord Darzi, found the health service is facing rising demand for care as people live longer in ill health, coupled with low productivity in hospitals and poor staff morale. But speaking at an event in London on Thursday, Mr. Starmer argued working people can't afford to pay more in taxes, so the NHS two options were to reform or die, of course. Even in difficult economic circumstances, a Labour government will always make the investment that is needed in the NHS. Always, the Prime Minister said in a speech to the King's Fund, but we have to fix the plumbing before turning on the taps. He went on, so hear me when I say this, no more money without reform. I'm not prepared to see even more of your money spent on agency staff that cost $5,000 a shift, on appointment letters that arrive after the appointment, or paying to keep people in hospital just because they can't get the care they need in the community. But concerns were raised for suffering patients who don't have a decade to wait for long-term reform. Mr. Starmer admitted change would need to be seen along the way, but said the NHS would need major surgery, not sticking plasters. Asked by the Mirror whether patients would continue to wait hours on end for 10 more years, he said, "I accept that whilst the overall change needs a 10-year plan, we've got to show the change along the way." Critics said a lack of any proper details on how to fix social care was the elephant in the room as the PM set out plans and out. Mr. Starmer insisted the future of the NHS depended on a good social care system, yet only repeated his ambition to have a national care service when pressed on his plans. He hinted that capping care costs will be included in the 10-year plan, but cautioned that such a measure must be deliverable. Lord Darzi said it is impossible to understand the situation in the NHS without understanding the state of social care, despite it being outside the scope of his investigation. He said the dire state of social care means 13% of NHS beds are occupied by people waiting for social care support or care in more appropriate settings. After the speech, Age UK said the task of reforming and refinancing social care must be looked at straight away. Caroline Abrahams, charity director at Age UK, said, "It is essential that the 10-year NHS plan, for which the Darzi report establishes the baseline, sets out how we can ensure social care plays a full part in the joined-up care at home or a care home that many older people need." Lib Dem Health and Social Care spokeswoman Daisy Cooper said the damage done to the NHS by the Tories was unforgivable. But she added, "The elephant in the room is that we cannot reform our NHS without reforming social care." Key findings from Lord Darzi's report: the health of the nation has deteriorated, with more years spent in ill health. Factors affecting health, such as poor quality housing, low income, and insecure employment, have moved in the wrong direction over the past 15 years, with the result that the NHS has faced rising demand for healthcare from a society in distress. There has been a surge in multiple long-term conditions, including a rise in poor mental health among children and young people. Fewer children get their vaccines and fewer adults now participate in things such as breast cancer screening. Waiting times targets are being missed across the board, including for surgery, cancer care, and mental health services. The report says long waits have become normalist, and AE is in an awful state, with long waits likely to be causing an additional 14,000 more deaths a year, according to the Royal College of Emergency Medicine. By April 2024, about 1 million people were waiting for mental health services. The overall NHS waiting list stands at 7.6 million. People are struggling to see their GP. GPs are seeing more patients than ever before, but with the number of fully qualified GPs relative to the population falling, waiting times are rising and patient satisfaction is at its lowest ever level. Cancer care still lags behind other countries and cancer death rates are higher than in other countries. There was no progress whatsoever in diagnosing cancer at stage I between 2013 and 21. However, more recent figures show some improvement. Progress in cutting death rates from heart disease has stalled while rapid access to treatment has deteriorated. For example, the time for the highest-risk heart attack patients to have a rapid intervention to unblock an artery has risen by 28% from an average of 114 minutes in 201314 to 146 minutes in 20223. The NHS budget is not being spent where it should be, and too great a share is being spent in hospitals, too little in the community, and productivity is too low. Too many hospital beds are taken up with people needing social care. Between 2009 and 2023, the number of nurses working in the community fell by 5%, while the number of health visitors dropped by nearly 20%. At the start of 2024, 2.8 million people were economically inactive due to long-term sickness, with most of the rise since the pandemic down to mental health conditions. The report said being in work is good for well-being, and having more people in work grows the economy. There is therefore a virtuous circle if the NHS can help more people back into work. Raids on capital budgets have left the NHS with crumbling buildings and too many outdated scanners, and parts of the NHS are yet to enter the digital era. The report says the NHS is in the foothills of digital transformation. The NHS delayed, cancelled, or postponed far more routine care during the pandemic than any comparable health system. Too many NHS staff are disengaged, and there are distressingly high levels of sickness absence. The pandemic was exhausting for many, and the result has been a marked reduction in discretionary effort across all staff groups. Regulatory-type organizations now employ some 7,000 staff, or 35 per NHS provider trust, having doubled in size over the past 20 years.